Our nose is the central, most prominent feature of our face. When the nose is out of balance with other facial features, it can greatly influence overall facial appearance. Rhinoplasty is cosmetic surgery that improves the appearance of the nose and its relation to other facial features. The result of rhinoplasty often is an improved self-image and greater self-confidence. Cosmetic surgery of the nose is a highly individualized procedure that may address one or more of the characteristics that contribute to the overall appearance of your nose. In planning the approach to rhinoplasty, your plastic surgeon will carefully evaluate your overall facial appearance, proportion, and structure, also carefully considering your personal heritage and goals. Rhinoplasty may enhance or reduce nose size and width, and may improve symmetry. The profile of the nose is improved by reducing visible humps or filling depressions. Rhinoplasty can also improve a nasal tip that is enlarged or one that is bulbous, drooping, upturned or hooked, and nostrils that are large or wide. In addition, rhinoplasty can make the relationship between the nose and upper lip more pleasing and proportionate. Characteristics of the nose are not the only factors contributing to facial imbalance. Facial structures, such as a small chin, flat cheeks, or a poorly defined lower jaw, excess fat below the chin, or a double chin can contribute to a disharmonious facial appearance. Rhinoplasty may be combined with a variety of procedures to enhance facial harmony and proportions, including facial implants or surgical lengthening of the facial bones. Surgery of the nose may address both cosmetic problems and structural defects that obstruct the airway and impair breathing. In such cases, the aspects of your nasal surgery that are not cosmetic may be covered by insurance. In order to gain authorization from your insurer, a physician must perform a detailed exam verifying the cause of your breathing impairment. This program presents an overview of rhinoplasty, surgical revision of the nose to improve its appearance. This information is not a substitute for a complete consultation with a plastic surgeon certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. Whether your desire is to change your appearance or to improve breathing function, surgery of the nose is most often performed when facial growth is complete, generally at age 15 or older. Good candidates for surgery of the nose are healthy individuals who do not have life-threatening illnesses or medical conditions that can impair healing or risk overall health. A patient who smokes is at increased risk of poor healing and therefore must stop smoking for several weeks before and after surgery. In addition, you should be able to define your goals for surgery of the nose. That is, you should have a clear idea of what bothers you about your nose and your appearance. A consultation with a board-certified plastic surgeon, a member of the American Society of Plastic Surgeons, who may also be a member of the American Society for Aesthetic Plastic Surgery, is the first step to learn how surgery of the nose can enhance your appearance and improve your self-image. A consultation is designed to fully educate you about rhinoplasty with a discussion of your goals, the options available, the likely outcomes, and potential risks and complications. Your surgeon will also describe the surgical procedure and answer your questions. During a consultation, you will be asked to share your expectations for your surgery and your personal health history. Full disclosure of your health history is important for your safety. You should inform your plastic surgeon of any life-threatening illnesses or medical conditions affecting you or your family. You must also be candid about your current medications, vitamins, herbal supplements, alcohol, tobacco, and drug use. By making the decision to consult with a board-certified plastic surgeon and following your surgeon's recommendations, you are taking an important step in helping to ensure your safety. A board-certified plastic surgeon is a physician who is specifically trained in plastic surgery of the face and entire body. Prior to your procedure, you will be asked to sign informed consent documents. These documents assure that you fully understand the procedure you will undergo, including the potential risks and complications. In addition, you must commit to precisely following all of the instructions you are given. Instructions include pre-surgical considerations, such as testing and medications, day of surgery requirements, and specific information related to the use of anesthesia. Prior to surgery, It is important that you and your surgeon discuss any questions and concerns you may have regarding your surgery. Surgery of the nose may be performed in an accredited office-based surgical facility, an accredited ambulatory surgical facility, or hospital. The decision for anesthesia will be based on the requirements of your specific procedure and considerations of patient and surgeon preference. Rhinoplasty is performed in two ways: as a closed procedure, where incisions are hidden in the nose, or an open procedure, where an additional incision is made across the columella, the narrow strip of tissue that separates the nostrils. These incisions allow visual and surgical access to reshape the structures of the nose. To enhance the appearance of the nose, nasal structures, including bone, cartilage, and soft tissue, may be reduced or sculpted to the desired shape. Alternatively, cartilage may be grafted from other areas of the body, or synthetic materials may be used to build up nasal structures. In order to alter nostril size, additional incisions will be placed in the natural creases of the nostrils. To improve the angle between the base of the nose and the upper lip, an incision at the columella may be necessary. Once the nasal structures and soft tissue are reshaped, the skin is redraped and the incisions closed. A splint will likely be placed to support the nose as it heals. In some cases, nasal packing may also be placed to further support the nasal structures. It is important that you do not remove splints or packing for any reason unless you are specifically permitted to do so by your plastic surgeon. Before being released, you and an accompanying family member, friend, or caregiver will be given specific instructions that may include how to care for the nose following surgery, medications to apply or take orally to aid healing and reduce the risk of infection, specific changes to watch for in the nose or in overall health, and when to follow up with your plastic surgeon. Your plastic surgeon will instruct you to keep your head elevated at all times following nose surgery until initial swelling subsides. A return to light, normal activity is possible as soon as you feel able, usually within a few days of surgery. Initial conditions that are a normal part of the recovery process include swelling, bruising, headache, and discomfort that can be controlled with medication and cold compresses. If packing was placed in the nose, it will be removed within the first week. You may be instructed to wear the splint for an additional week or two to help protect and shape the recovering area. Cosmetics can camouflage any bruising that has not yet resolved. Healing will continue for 4 to 6 weeks as swelling subsides and nose shape refines and settles. Diligent protection from the sun and from potential injury during physical activity for the next 4 to 6 months is essential. Complications from nose surgery include an outcome that is not fully predictable, largely due to the healing process. If the final results are not consistent with the goals that were agreed upon by you and your surgeon, a second and usually less extensive procedure may be recommended. Additional complications associated with surgery of the nose include nosebleed and, very rarely, infection. In addition, there are associated risks with the use of anesthesia that your surgeon will discuss with you. Rhinoplasty can help you achieve improved facial harmony and enhance your self-confidence. The appearance of your nose and results of rhinoplasty will be revealed gradually. A year is considered the minimum for your final outcome to be achieved. Results of nose surgery are generally considered permanent. However, it is possible for results to change over time due to movement of cartilage as well as the aging process. Choosing to undergo surgery of the nose or any plastic surgery procedure is an important decision, as is selecting a plastic surgeon. The American Society of Plastic Surgeons and the American Society for Aesthetic Plastic Surgery have prepared this educational program to supplement your personal consultation with a plastic surgeon who is certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. Plastic surgeons with this certification have completed approved surgical training and rigorous examinations in plastic surgery, including both cosmetic and reconstructive procedures of the face and entire body.